Nearly 60 million people in the United States suffer from allergies, and I am one of those people. And nearly 100 to 200 of them die per year. Sometimes the only difference between life and death is an Epi Pen. And that is why most of them carry an Epi Pen with them 24 hours a day, 7 days a week. An Epi Pen is a medical device used to deliver a measured dose of epinephrine. Epinephrine is a hormone that stimulates the heart and constricts the blood vessels. Knowing how to use an Epi Pen is very important when someone is going through anaphylactic shock. The first step in the very important process is to grab the Epi Pen carrying tube and take the Epi Pen out and hold it in your dominant hand. The black tip should be opposite of your thumb. Next, take off the gray activation cap, which should be right next to your thumb. Make sure after you have done this to not touch the black tip because this is where the needle comes out. Now, hold the Epi Pen facing the victim's outer thigh and gently but firmly shove the Epi Pen into their thigh and hold it there for 10 seconds. To make sure the dose is being distributed evenly, massage the injection area for 15 seconds. Look at the black tip now. If the needle is exposed, the epinephrine was injected. If not, repeat all the steps. Now, place the Epi Pen back into the carrying tube, needle first, and cap the tube. Make sure you take it to the hospital and give it to the doctor for proper disposal. Even though the epinephrine has been injected, you still need to go to the hospital because at any time the patient needs to come back. So this is why you need to call 911 or have someone take you to the emergency room. 25% of people in our country have allergies. With such high numbers, I believe that our society should be informed of these life-saving techniques. This is why I ask you to tell your friends, to tell their friends, to take 10 minutes out of their day to learn how to use an Epi Pen. And together, we can save lives. So, you demonstration. Trainer, don't worry. Take it out of the carrying tube and hold it in your dominant hand, which is, for me, is my right. Take the gray activation cap off and you hold it towards the victim's outer thigh. You jab it in and hold it there for 10 seconds. After you take it out, you massage it for 15 seconds. And then the needle should be exposed. If not, you will get it. And then needle first, as if there were one, you put it back into the carrying tube and cap it and call 911. Yeah.